Hey, Dr. Ferguson coming to you from the Passioncam. Hope everybody's doing well today. You know, I frequently am in a conversation with patients and family in reference to going into a nursing home or not going into a nursing home. And that's a very tough decision that one has to make, particularly if they've kind of made a pattern in their mind or a thought in their mind that, you know, I'm never going to put mom in a nursing home, I'm never going to put dad in a nursing home, I'm never going to do that, I'm never going to put them in assisted living. So when you already have that kind of in your mindset, that can definitely make it challenging when you have to actually do something like that. And so what I would encourage you to do is do your homework. There's lots of nursing homes out there, assisted livings out there, facilities that can be a place where a person can stay, group homes, things like that. So there's lots of things out there that potentially can be used. The more you know about those things and understand those things, the better it's going to be for you. So everybody's eventually going to get older, and having a plan once you get older, very important. What are you going to do when this occurs? Do you have the cash flow set aside? Have you talked to the social service department? Is the retirement, all of those things in place? You know, all of those are part of the equation on whether somebody ends up in a nursing home or assisted living or not, because many times it comes down to cash. If you have enough cash that you can hire people around the clock to keep that person at home, then often you probably end up doing that. But if you don't have enough cash to do that, and you're talking about a lot of expense, then you do end up doing that. And just going into a nursing home itself, it can be expensive. Somewhere between $3,000 and $10,000 on a monthly basis. That's a lot of money. A lot of people don't have that type of cash flow to be able to do, or go into a nursing home or stay at home with. So because of that, do your homework, visit some homes, talk to people, see what they like, what they don't like, and then make a decision based on that. But don't be so cut and dry, never going to put mom in a nursing home, never going to do it, because you might have to do it one day, and it'll be a whole lot easier to do if you haven't made a decision cut and dry that you're never going to do it. And if you do have to do that, if you spend more time in that nursing home and you're frequently in there, you're frequently visiting, you're coming in, helping get your loved one dressed and help feeding them, things like that, then I think you'll probably be happy, because the more you're there, the more you're in and around the scenarios that are taking place, then the more it's going to take place the way you want it to take place, because you're there, you know, helping kind of direct traffic the way you want it to happen. You might like a bow on the right side of her head as opposed to the left side of her head. You might like to be on channel 3 as opposed to channel 10. Again, the little things, but the more you're there and involved in the person's care once they move into an assisted living or some type of nursing home setting, I think the happier you'll be, because the more you'll be able to direct the traffic to the types of things you know are important. Another thing that can be very helpful is, before your loved one goes into a nursing home or assisted living, write out a handwritten letter, typewritten letter, whichever you choose, on what your loved one likes, what they used to do, where they used to go, types of things they like on television. And that can be very helpful to people that are meeting them for the first time. If they can read a personal letter like that, it makes a new connection. Maybe have a special nickname they like to be called. Maybe they like to be called, you know, I don't know, hey you, whatever that might be. But that they're more comfortable with being called whatever that nickname is. And so if the staff knows to do that and does that, I think that also helps the person be more comfortable knowing personal things. You know, she likes to do this, she likes to go here, she likes her hair done on Thursday, she used to go shopping every Wednesday, she worked for 25 years as a receptionist. Knowing those little personal things can be very, very beneficial to all those that are dealing with your loved one at the nursing home. So don't just take it for granted, or the little bit that you might tell them on your interview, your entrance interview. The only people that are going to know that are the few people that you told that to, that might not make it to everybody else. But if you actually write out that letter and encourage anybody that comes in the room to read it, or you could have copies of it there, or you could tape it on the wall, tape it on the door, you could ask that to go in the chart. However you want to get that information out to the masses that are going to be helping with your loved one, I think you'll find it very, very beneficial to do something like that. On that note, Dr. Ferguson coming to you from the Passioncam. Be blessed. Have a wonderful day. This is a little longer than my usual Passioncam, but I think the information was good and not to break it up. All right. Be blessed. Bye-bye.